that. And exercise, exercise, exercise. Exercise is so important. Exercise can be either to Lola's standard, but only she can reach that standard. But everybody else can just go for a walk, right? Just go for a walk for an hour a day. This myth, and I had this, that periods are supposed to be painful. Is that for many years, I thought it was completely normal to actually have severe pain. It isn't. Can we just take this away from me? It really isn't. Yeah, to have a bit of cramping pain and so on, but not pain that stops you from doing what you normally would be doing, okay? Your young daughters or yourselves who've always had really severely painful periods, you need to come and get checked out and get a scan. The menopause is when our periods stop. You diagnose the menopause when you have not had your periods for 12 months, okay? People often think that we can do hormone tests and diagnose menopause. We can't, okay? Often people go through a period of perimenopause where their periods become different. They become irregular, sometimes infrequent, sometimes they become heavier. Because when we're born with our set number of eggs. That doesn't change. And that number declines as we get older. And when we have no more eggs, our periods stop and then we go through the menopause. So fibroids can, as I said, they cause our womb to be much bigger, so they increase the surface area. So therefore our bleeding tends to be much heavier, and sometimes we have clots and we get this pain and the cramping. And if you're bleeding heavily and your periods are longer for 10 days, in fact some people never stop bleeding, you drop your iron level and you become anemic. And when you are anemic, severely anemic, that causes a number of issues, including hair loss, yes. Okay, so what is the treatment for fibroids? So fibroids doesn't always mean surgery. Like people come to me and they run and they're like, oh my gosh, I've been diagnosed with fibroids, I need to have surgery. No. Treatment depends on a number of factors. It depends on the size and location of fibroids. So like I said, many of you will have small fibroids. It doesn't mean anything, you don't need to do anything. Treatment options are broadly split into three types. We can have conservative management, which we reserve mainly to if the main issue is symptom control. So if somebody's having heavy bleeding, they're anemic, maybe they're having pain. And sometimes we do that with hormonal treatments, so such as the oral contraceptive pill, or you may have heard the Mirena coil. But then we can have minimally invasive treatments. And these are focused on trying to shrink the fibroids to a point where they can improve the symptoms. Now, maximally, you can only expect maybe 15 to 20% shrinkage, okay? It doesn't just dissolve them and they disappear. And the two main ways are uterine artery embolization, that is where we block the main blood vessels that feed the womb, or something newer called MRI-focused ultrasound.
What an amazing day I've had at the Ori Lifestyle Wellness event. It's just been so informative and topics that I'm that really mean a lot to me and resonate with me about my skin, to do with things like fibroids and things that really concern me.
Honestly, we talk about health not just from the hair or the skin, but then we talk about the root of it. And I think like the three individuals that came today just kind of nailed every area